Hello doctors, welcome back to my channel again. So as you know, I'm continuing the medicine. So welcome back to my channel again. So these are the QR codes of my Telegram channel and this is for Instagram. So you can access the PDFs anytime if you want. You just scan these codes and you enter my channel. So feel free to ask any questions, whatever I discuss in the topics, and you can comment in the comment section below. Like the way I am teaching, if you don't understand what are the questions you have, you can comment in the comment section. So without any delay, let's start our topic. Today I am discussing about the gout. So it comes under the connective tissue disorders. Previously under the connective tissue disorders, as a heading I discussed the first topic is SLE and second topic is rheumatoid arthritis and third topic is scleroderma, and today I am discussing the fourth topic, that was gout. So let's write this. As you know, I am just writing for every session under the connective tissue disorders. Let us write it first. Please try to write along with me so you can remember. So whatever I am teaching you and you are writing it again, so you can remember the things for your life. Okay. Connective tissue disorders. Under connective tissue disorders, the first one we already finished, that was SLE, and second one rheumatoid arthritis, and third one, that was scleroderma, and the fourth one today we are going to discuss, that is gout. This is most important topic for the exam. At least you can expect one question from this area. Okay, I am going to tell you where the question comes from and try to watch till the end so you can get the clear concept about the gout. So let us start. Gout. Let's understand what is this gout. Gout is inflammation of synovial joints due to accumulation of monosodium urate crystals. Whenever there was accumulation of monosodium urate crystals, that leads to inflammation. So you know the four cardinal signs of inflammation, that was rubor, calor, dallor and tumor. So let's discuss this further. Let me write it, whatever I said just now. The crystal induced inflammation of synovial joints. What is these crystals? These crystals are monosodium urate crystals. Remember this point. What type of crystals are these? These are monosodium urate crystals. Let me write it first. Inflammation of synovial joints. What are these crystals made up of? These crystals are made up of monosodium urate crystals. These are accumulated in the synovial joints. These crystals are negatively charged. Okay, these crystals are negative charge crystals. These crystals will activate complement system. So by activating the complement system, it will cause inflammation. It will cause inflammation. This is how it is causing a pain and swelling and redness in the area of the particular joint. This will cause a problem to the patient. That's why the patient comes to us. Okay. So let's classify the gout into an acute gout and chronic gout. So first we are going to discuss acute gout. So I am going to write the gout. Under gout we are discussing acute and other one is chronic gout. In the acute gout, so what is the most common joint involved? I hope you guys know. Even I have seen many patients, like the most common joint involved for these patients is MTP joint, that was metatarsophalangeal joint. What I am telling you, the most common joint involved in gout is MTP joint. MTP joint. MTP joints means it was in our big toe. It was in the big toe. That was our MTP joint. I gonna show you the image as well. Okay. And the other joints also involved here, which was knee joints as well. Let me write it. Other joints involved in acute gout, that was ankle joint. Ankle joint, I'm just putting JT, that means a joint, and knee joint. If the knee joint is involved, then that we will call it as pseudo gout. Okay, this is a kind of gout, but it looks like a gout, but this is not the gout. Okay, here the crystals what was accumulated is calcium pyrophosphate crystals. Calcium pyrophosphate crystals, these are accumulated in the knee joint, but in gout that was monosodium urate crystals. This is the difference here. Even I am going to discuss further how to differentiate between the pseudo gout and the normal gout, what we are discussing now. So as for now, you just remember, in the gout, what are the crystals accumulated in the gout? That was monosodium urate crystals. This is further causing inflammation. Okay, but here in knee joint, if the crystals accumulated, this is called pseudo gout. What type of crystals accumulated in the pseudo gout? That was calcium pyrophosphate crystals. These are the crystals accumulated in the pseudo gout. Okay, so let's move further. So I'm just going to ask a single question. So what is the age group of females involved in this disease? Try to think. What age group of females involved in this disease? Do you remember anything? Yes, that was a middle-aged or postmenopausal female. Especially, most commonly, try to remember, most common females involved in this disease is postmenopausal females. Postmenopausal females. If a lady comes like 20 or 30 years lady, if comes to the clinic, if she complains like there was some problem in the big toe, there was swelling and inflammation, don't try to jump into the gout, because the most common age group for the gout is postmenopausal. Even previously I was confused about this, but now I got clarity. Even well, I when I went to the rheumatologist, and my relative also suffered with this problem, and I also suspected it as a gout. Previously, I don't know about this point. Even I was very confused. So that's why I jumped into the gout. But he said it was most commonly seen in the postmenopausal females when compared to premenopausal females. So I'm just trying you to not to confuse when it comes to, like, when a patient comes to the OPD. Okay. So let's go further. So I'm going to write the same point, whatever I said you. The most common age group females involved is postmenopausal females and middle-aged females sometimes. In the question itself also, you need to look the age groups. When the question comes, you also need to look about the age groups, what age groups they have mentioned. If that was like 50 55, so you can suspect a gout. Okay, if they mention it as 20 or 30, try to look the other problems, try to eliminate this option, because this is most common in the postmenopausal females. Okay, so I'm going to write the same point what I said you. Okay, the most common age group involved is middle age, this is female, and post menopausal woman. Okay, so let's discuss how this patients comes to us, what the lady shows to us. This is very important point that we will call it as clinical features, how they will present to OPD. This is CF means clinical features. First they will present with podogra. This is something different word, but try to remember podogra. This is most common word. You try to remember it. This is very important. Let me show you how this podogra looks like. See, see this. This is podogra. You see this at the MTP joint. This is MTP joint. Here there was a podogra because there was accumulation of monosodium urate crystals in this area that was causing cardinal signs of inflammation, and this results in pain, and there was limited movements, and there was swelling and increase in the temperature, and if you try to touch that area the patient complains of pain, and you can even feel the warmness at that area. So this is called as podogra. So I'm just going to write under the image podogra. Try to remember this image. If image question comes in the exam, don't try to miss this question. Okay, podogra, what does this podogra means? It is an inflamed joint. It is an inflamed joint. In this inflamed joint, it is causing the cardinal signs of inflammation, that was a rubor and calor and dollar and the tumor, and it is also leads to loss of function. So I hope you guys know, I hope you guys read the basics of pathology in the inflammation chapter. I'm going to discuss there what does this rubor, calor, dollar and tumor and loss of function means. As a words I will just explain you what does this means. Rubor and calor. Rubor means redness. Here in podogra you can see the redness, and calor means increase in the temperature, means when you touch this area you feel the warmness, and the dollar means a pain. Okay, and it also leads to loss of function of that particular joint. Okay, and the patient will also show you one more feature, that was a tophi. If the disease progresses more, then the patient presents with a small balls, a kind of small balls over the joints of their fingers. You know, this problem, this gout is not symmetrical. This is asymmetrical. Like if you see the tophi means, I'll just show you what does this tophi means. Let me write it for first. TOPHI, tophi. What does this tophi means? Tophi means subperiosteal deposition of uric acid. Subperiosteal deposition of uric acid. You know, these tophi are asymmetrical. So you cannot see this tophi in the both hands. It can be only appreciated only on the one hand. So asymmetrical joint involved. And let me show you how does this tophi looks like. See, these are the tophi. These ball-like structures, these are the tophi. These are asymmetrical. This is mostly appreciated. See, this one is tophi. Tophi means subperiosteal deposition of uric acid. Here there was a deposition of uric acid that leads to the tophi. So let me write it, the tophi. This is tophi, and if there was increase in the monosodium uric acid crystals, that will be accumulated, that will be stored in the kidneys as well. If there was more uric acid stones, more uric acid crystals, more uric acid is stored in the kidneys, that will cause nephrolithiasis. Okay, nephrolithiasis means stones in the kidneys. What kind of stones? These are uric acid stones. I hope you guys read the surgery subject. In that, your faculties will discuss about it. There was an types of stones. There are different types of stones. Is there a kind of stones is steroid stones, and this is monosodium uric acid stones. So different kinds of stones that will cause nephrolithiasis. So it will also cause, let me write it, nephrolithiasis. Nephrolithiasis means stones in kidneys. This is nephrolithiasis. So after the clinical features, the patient comes to clinic, she will show you, let me discuss again, she will show you this kind of inflammation here. This is known as podagra, and she will also, if there was a progression of the disease, she will also show you a kind of ball like structures in her hand, and some ladies, they will complain about nephrolithiasis, stones in the kidneys. Okay, so after that, what you're going to do is to find out what is this disease. By just looking the patient or by just hearing the patient words, you cannot know what does this disease mean, and you'll just do some investigations. So let me write it, how we'll diagnose. So this is under the heading of diagnosis. So, under the heading of diagnosis, what is the investigation of choice we are going to do? Investigation of choice for gout is the joint aspiration. Joint aspiration. So, what does this joint aspiration means? So, whenever, let me just say, see, here there was an podagra is there. So, we just put a needle here. We just insert a needle here. We'll just take the fluid from this area. That was an inflammatory fluid. So, here you'll just count the cells. If that was hypercellular, like whenever there was an inflammation, the number of cell count here also increases. There was an inflammatory cells that will increases. That will leads to hypercellular fluid. You can see here, hypercellular fluid. So whenever you see a hypercellular fluid that is turbid in nature, this is turbid in nature. Normally in the joint, if you aspirate the joint fluid, the normal cells, usually in the normal patient, the cell count is less than 200 cells. But in the gout patient, the number of cells is more than 2000 cells. So, increase in the number of cells due to the inflammation here because of the deposition of the monosodium urate crystals. So, if you observe this fluid under the polarized light, you can appreciate this crystal shape is needle shape. I hope you guys know this point. Under the polarized light, if you see the crystals, it looks like needle shape. These crystals are monosodium urate crystals. Under the polarized light, it looks like needle shape. Needle shape. These are needle shape under the polarized light. Remember this, under polarized light, they looks like needle shape. Let me write it, what just I said you. These are uric acid crystals. Uric acid crystals under polarized light. They looks like needle shape. Remember this point, this is very important. The uric acid crystals under polarized light looks like needle shape. This point is very important. Try to remember this. A question can be expected here from this area. Okay. So the next investigation we are going to do is 24 hours uric acid evaluation. Okay. 24 hours uric acid evaluation. It can be normal or maybe it can be increased. Okay. And the next most important thing we are going to do is urine microscopy. Here if the uric acid is increased in the body, so it will be also increased in the urine. So we are going to take we are just going to collect the urine under the microscope. We are going to see so what type of crystals we can see in the urine. So we are going to do urine microscopy examination. Under the microscopic examination, we are going to see our urine. What does this contains? This urine contains needle shaped crystals. Needle shaped crystals. This needle shaped crystals, it has a property of negative birefringence. Negative birefringence means this is a property which was seen under polarized, PM means polarized microscope. This was birefringence, and whenever you see this needle shaped crystals under electron microscope, here there was positive birefringence. These crystals are called calcium apatite crystals. These crystals are called calcium apatite crystals. Calcium apatite crystals. These are calcium apatite crystals. So I know you guys got confused. So let me explain this clearly. So when you take the urine of the patient, urine sample from the patient, so we'll just put under the microscope and we'll just see so what type of crystals these are. So if you see under the microscope, you see a needle shaped crystals under polarized microscope. If you see under the polarized microscope, these are needle shaped crystals, then it has a property of negative birefringence. Then we will confirm it as gout. Okay. Or else if you see the urine under the electron microscope, you appreciate calcium apatite crystals. These two also looks like needle shaped. When you look under the electron microscope, if you look under the polarized microscope, you see the needle shaped crystals. It has an negative birefringence property, and this is called as gout. Let me write it. It is called as gout. This is called as pseudo gout. So this is how you are going to differentiate between the gout and pseudo gout. So both of them have the needle shaped crystals. You need to look in the question. So what they are talking about? They are talking under the polarized microscope or electron microscope. If they talk about polarized microscope, they talk about negative birefringence. You need to mark it as gout. If they talk about electron microscope, they view under the electron microscope, the crystals are calcium apatite crystals. The property is positive birefringence. Then you need to mark pseudo gout. This is difference between the gout and pseudo gout. This is how we are going to differentiate by doing the urine microscopy examination. Okay. So I make it very clear. So even after the whole topic I am going to discuss again, and I am going to revise it within a 5 minutes. So even if you don't understand now, don't worry, and you will get the clarity about this whole concept again. I am going to discuss it again. Okay. And after this, you will also do X-ray as well. You're going to do X-ray. Under the X-ray, what you'll find is martel sign. I know these names look something different, and previously I said you there was an one different name. This is podagra, and other one was tophi. These two are the new names, and you need to remember one more name, one more sign, that was martel sign. What is this sign? Martel. You know the jet company, that was Martin. That's how this is Martel. Martel. Martel sign. What is this Martel sign? Martel sign is the erosions with sclerotic margin. So whenever we take the, let me just show you the X-ray, and I will explain you how does this Martel sign looks like. See, see, see here, this is a podagra. I already told you this is podagra. When we take the X-ray of this joint, here we can see the blackness. See here, there was a blackness. This is the normal bone, this is a white, and this is the normal bone. But whenever you see here, there was a blackness, that is erosions with hanging margins. See here, there was a small hanging margin, and sclerotic means hard, thick, hard margins. That's why the patient is getting pain. Here the inflammation is going on. So this is how it appears. That was called as Martel sign. It is a sign of a gout. When you just take an X-ray, you will find this sign. This is known as Martel sign. Just try to remember this sign. This is Martel sign. If the X-ray image comes in the question, you need to mark the Martel sign. Don't forget to mark. Every one mark is also very important. Try to focus on each question and try to answer it properly. I always say, if you lose that one mark, you'll cry for 6 months or 1 year. It depends on the exam what you are attending. Okay. Try to answer the question, try to read the full question with 100% concentration, with the 100% confidence. I know you guys will do well in the exams. Okay. Don't lose your confidence, don't lose your hope. Try until you get success. You need to try. That's the one and only option. You don't have another option. You need to try. That's the option. Okay. After we do the X-ray, and after doing all the investigations, we confirm it as a gout. So the patient is suffering with gout. Now what we are going to do? We need to treat the patient. So how we are going to treat the patient? For the acute gout, I am just talking about, not the chronic gout. For acute gout, how we are going to treat the patient? So there was a more symptoms, more pain, and more swelling, more redness in the patient of an acute gout. The symptoms are severe here. So how we are going to treat the patient? First, we need to decrease the pain and swelling, okay? And we need to decrease the inflammation, what was going in the joint. First, we need to focus on that. So, that be treatment we are going to give for the patient is, TX means treatment for the patient we are going to give is, first we give painkillers. And we ask the patient to put the ice packs to reduce inflammation and redness. Okay, ice packs. And we give steroids. We give the steroids, so it will decrease further inflammation. It do not slow the progression, but it will decrease the inflammation. That's why we prefer the steroids. If we give the steroids, when we'll give the steroids, we don't give when it only involves one joint. We give steroids if the disease is involving more than 4 joints. That was called polyarticular. This is known as polyarticular joint involvement. Okay, if a patient comes to us, there was only pain when there was swelling, where there was a redness, there was a tophi in a single joint, you don't try and jump and giving the steroids. I don't recommend it. For one joint involvement, you just try to give the painkillers and ask the patient to put the ice packs. That's good enough. If that was more than 4 joints, it was an polyarticular, we'll call it as, and we give the steroid injections, so it will decrease the inflammation. Okay, so we finished with the acute gout, and now I'm going to discuss the chronic gout. So, under the chronic gout, we are going to check the uric acid level. So, the normal uric acid level might be less than 5, that was normal. If more than 7, that was very severe increase in the levels of uric acid. Is more than 7, we need to rush to the treatment. Let me write it first. If increase in uric acid levels greater than 7 mg per deciliter, here we'll start the treatment. So how this gout is producing? See, one is by overproduction, one is by decreasing in the elimination of the uric acid. See, if the gout is by overproduction of purines and pyrimidines, the xanthine oxidase enzyme, the xanthine oxidase enzyme, this is helping to produce purines and pyrimidines. So there was defect in the purine pathway, that will leads to increase in the uric acid levels. So here we're just going to control in the treatment, we are going to give xanthine oxidase inhibitors. See, what's the function of xanthine oxidase? It helps in production of the purines, and purines that will further cause more increase in the more symptoms in the gout. That's why we are going to give the patients a xanthine oxidase inhibitors. What are these xanthine oxidase inhibitors? I hope you guys remember the two famous drugs, that was allopurinol and febuxostat. So both comes in the question if the examiner asks you to twist and to confuse you. So if the allopurinol and febuxostat both comes in the option, you need to answer it as allopurinol. Okay, allopurinol is the best answer you need to answer for this area if the question comes in the chronic gout. So here the overproduction and under excretion. See here, see how the uric acid is increasing in our body, because there was something overproducing the uric acid, and here there was decreased excretion. If there was decreased excretion, this uric acid levels will increase in our body. So this overproduction is due to defect in purine pathway. So this defect in the purine pathway, that will leads to overproduction, and that will further cause increase in the uric acid levels in our body. And here also there was under excretion. If when you can see there was an under excretion, when there was the decrease in the excretion from our body, when the patient produces a less urine. Let's say if there was a kidney failure patient, let's say kidneys are not functioning well, so in that cases the uric acid is not eliminated from our body, it stays in our body, that will lead to increase in the uric acid. That's why I'm going to write the same thing whatever I said now, that was in cases of decreased GFR, or in the cases of impaired renal function. Let's say impaired renal function means a decreased GFR means CKD. In the CKD cases, there was a kidneys damage, so it cannot filtrate the uric acid, so it was accumulated more in our body, that was causing chronic gout, that will lead to increase in the uric acid levels. This is very simple. And how we are going to treat the patient for a chronic gout? See, here the treatment is, first we are going to decrease this overproduction. So we'll stop this overproduction, and next here we'll increase the excretion. This is the two ways we are going to give the drugs, so that will help the patient to decrease the uric acid levels. So our aim is to decrease the uric acid levels. And next, what are the symptoms, like what are the clinical features a patient have? If a patient is having a more tophi means more balls on the hands, because if he walks in the public it looks like something ugly, right? So that's why we are main focusing on decreasing the uric acid and decreasing in the tophi. You need to remember these 2 points. Our aim is to decrease the uric acid levels, which was increased already, by giving two kinds of drugs, that was by decreasing the overproduction and by increasing in the excretion of the uric acid. This is the two ways we are going to decrease uric acid in our body. So the treatment we are going to give, the first drug is allopurinol. I hope everyone in like our medical school listen this drug. This is most famous, allopurinol and febuxostat. Febuxostat. These two are xanthine oxidase inhibitors. These two are xanthine oxidase inhibitors. If we inhibit the xanthine oxidase, we are going to decrease the purines pathway, we are going to decrease the purines production, and this is how we are going to help the patient by decreasing the uric acid. And the other class of drugs, that was propionic acid, propionic acid, and next one is diu. These are diuretics and propionic acid. These are what we'll call these drugs as uricosuric drugs. These are uricosuric drugs. So what does this uricosuric means? These drugs will increase the production. These drugs will increase the urine production and further elimination of more uric acid from the urine, further decreases the uric acid levels in the body. This is how we are going to treat the patient. Finally, let me write it. What was our aim? Aim in the treatment is to decrease the uric acid levels. We need to maintain uric acid, serum uric acid levels normal for at least greater than 6 months. That was our aim, and we need to decrease the tophi also. This is our aim. So this completes our topic. So finally I am going to revise the whole topic. So try to recall along with me so you guys remember it for life. Okay. So this is today we are discuss about the gout. So finally, first the gout is the inflammation of the synovial joint. So how the synovial joint got inflamed? Because there was accumulation of monosodium urate crystals in the synovial joint, that will leads to activation of complement system. This is further causing inflammation. This is how the patient is suffering with the gout. Okay, here the point you need to remember is monosodium urate crystals. What is the type of crystals? Monosodium urate crystals. What is this charge? Negative charge. Then the gout. Gout further classified into acute gout, chronic gout. In acute gout, the most common joint involved is MTP joint. So let's say, what is this MTP joint? MTP joint means this is our MTP joint. Here you see the sign. This is called as podagra. In the clinical features, you are going to see this as podagra. A patient walks into the OPD, she will complain like in the big toe joint, she is having a problem, that was redness. If you see the redness in the big toe joints, try to suspect that was most commonly seen in postmenopausal females. Okay, when the postmenopausal female walks into the OPD, she complains she is having a pain or swelling in the MTP joint in the big toe. You try to try to think about gout. Okay, and there was one more problem along with this. It will also involve ankle joint, but if it involves the knee joint, then that we will call it as some, like in old age patients, like some females comes into clinic and they complains like, doctor, I'm having a pain in the, when I was walking I'm having pain, and there was a pain even when I wake up in the morning, I have a pain in the knee joint. Okay, when they says about the pain in the knee joint, you try to suspect this is not the gout, this is pseudo gout, this is due to calcium pyrophosphate crystals. Okay, I already told you this is most common in the postmenopausal female. This is most important. In the exam itself, they will mention like a 65 years or 55 years old lady, like a postmenopausal lady. You need to think about gout. Okay, and in clinical features, when you see this image, you need to answer it as podagra. Podagra is a clinical feature of a gout. What is this podagra means? Podagra means here there was an inflammation going on that will leads to rubor, calor, dullor, tuber and loss of function. Rubor, redness and calor is increasing in the temperature, like there was a warmness, and dullor means a pain, and tumor means there was a swelling, and here there was a loss of function. These are the cardinal signs of inflammation. Okay, this is going to happen in the gout. So next, if the patient shows their hands, like there was some balls in the hands of, like it can be in one hand or it can be on the both hands, but these are asymmetrical joints involved. If you see one joint is involved in the one hand, you see another joint is involved in the another hand, that's why we will call it as asymmetrical joint involvement. This tophi means basically subperiosteal deposition of uric acid, and if there was increase in the uric acid, monosodium urate increases in our body, that will be accumulated in the kidneys, that will cause nephrolithiasis. Nephrolithiasis means kidney stones. Okay, so finally we came into a point like the patient is suffering with the gout, so we are just going to confirm it by doing a diagnosis. How will diagnose? This is an investigation of choice, that was joint aspiration. So you take the needle and aspirate the fluid. If that fluid was hypercellular, like whenever there was inflammation going on, there will be a lots and lots of cells. If the cells are more than 2000, you confirm it as gout. This cells are, this hypercellular fluid is turbid in nature, and if you see uric acid crystals, if you need to confirm it as uric acid crystals, if you look under the polarized light, then you will see this uric acid crystal shape is needle shape. Okay, whenever you see the uric acid crystals under the polarized light, this will be in needle shape. Okay, this will be in needle shape. Uric acid crystals under the polarized light, that will be in needle shape. You need to remember this point. This is very important and you can expect a question from this area. Okay, and you can also do 24 hours uric acid evaluation. It can be normal or sometimes it will be increased, and this is most important, urine microscopy examination. So you collect the patient's urine and you just observe the urine under the microscope. When you observe the urine under the polarized microscope, you see the needle shaped crystals. This property is called negative birefringence. So you will confirm it as gout. Or else, if you observe the patient's urine under the electron microscope, you see needle shaped crystals. But here the stones are calcium apatite stones, not monosodium urate crystals. Here the stones are calcium apatite stones. Here the nature is positive birefringence. So you will confirm it as pseudo gout. So I am going to tell you again, this is the fourth time I am going to explain you the same topic. This is, if you see the same in the gout and even in the pseudo gout itself, there was needle shaped crystals. Both has needle shaped crystals. How we are going to differentiate between the gout and pseudo gout? That was when you look under the polarized microscope, you see negative birefringence, that was gout. Okay, under the electron microscope, in the question they mentions like electron microscope, if there was positive birefringence, if the shape of the crystals is needle shaped crystals, then this is calcium apatite. Then you will confirm it as pseudo gout. This is not gout, this is pseudo gout. And by doing the X-ray, you are going to see the erosions. See here, there was a black areas, that was erosions with the overhanging margins, that was called as Martel sign. You need to remember this sign. This is Martel sign. Here I discuss three different words. That was, one is podagra, and other one is tophi, and other one is Martel sign. And here one more important I said you was, under the polarized light, uric acid crystals is needle shape. This is very important. Okay. So here how we are going to treat acute gout, like the symptoms are more, though there was some more pain, so we give the painkillers to decrease the pain, and there was inflammation, so by putting the ice packs you decrease the inflammation. The steroids, if that was more than 4 joints are involved, there was an tophi in the 4 joints, or there was an 4 joint pains, you give the steroid injections, though it makes the patient better by decreasing the inflammation. Okay. So let's say if that was a chronic gout. If the chronic gout, how we'll consider is uric acid level more than 7. Normal uric acid level is less than 5. If there was more than 7 uric acid level, how the uric acid level increase? By overproduction or by under excretion. Means the excretion is decreased or the overproduction of uric acid happens in our body. How this overproduction of uric acid happens is, I hope you guys read this purine pathway in the biochemistry, and there was a defect in the purine pathway that leads to overproduction of uric acid, or else if there was an CKD patient, if you consider the kidneys are failed in some patients, like in CKD patients, that's why the GFR decreased, and there was an impaired renal function that leads to decreasing the excretion from the body, that will further increases the uric acid in the body. Okay. So how we are going to treat the chronic gout? By giving the allopurinol and febuxostat. I just made a mistake about the spell. Let me correct it. Right. Febuxostat is single, right. Febuxostat and allopurinol. What are these drugs? These drugs comes under the xanthine oxidase inhibitors. By inhibiting the xanthine oxidase, we are going to decrease the production of uric acid. Okay. In the question, the both drugs are mentioned. You need to mark it as allopurinol. Okay. And these two, like probenoic acid and diuretics, these two are uricosuric drugs, means they increases the production of urine. So further you can find more uric acid eliminated from the body. So this is why it is called as uricosuric drugs. So elimination of uric acid via urine, this is why it is called as uricosuric drugs. So our aim is to maintain uric acid levels normal for greater than 6 months and to decrease the tophi. Okay. So by this we are going to complete this topic, and I hope you guys understand the whole concept of the gout, and we finished the connective tissue disorders. I completed the 4 of the topics under the connective tissue disorders, and try to watch if you don't understand my lecture properly, and you put the video under like 1.5 or 2x again, you watch the video again, so you get to know the whole concept of each and everything what I have explained, and I discussed these topics very slowly, so that you can understand properly and you can answer all the questions. And even I am going to post the questions of these 4 topics under the connective tissue disorders in my shorts. I'm going to give the explanation as well, so guys, so that you do not miss any single question when the question comes from these 4 topics. Yes, thank you very much for your patience, for being a patience and listening my videos. And why you need to listen my video is, I always tells you 1 mark, that one mark, that was very important. If that comes from my videos, if you miss that, you will suffer. So that's why you need to listen my videos, and I am not only forcing you to listen only my videos. If you get a good concept from my videos, okay, no problem. If you don't fully complete your notes, try to watch another videos as well. That's how I will study. I'll watch the multiple videos and make my own notes. Or else if you don't find time to make your own notes, try to follow my PDFs. It was available in my Telegram channel. You can access anytime you can access. Even if you don't find anything, you can message in the Telegram group, or if you have any doubts, you can comment in the comment section. No problem, I will answer all the questions whatever you will ask. So let's make all the sessions very in a friendly manner, and let's try to focus and let's try to clear our shitty exams, shitty Indian exams, shitty Indian all the exams in your life, and make our lives very better. Okay, so thank you once again. Bye bye.